Minister, I want to welcome you to the House, and my only regret is that Minister Riley isn't here today, because he's the man I think I should be addressing all my concerns to in relation to the health service. This legislation, whereas it's welcome, it's 11th hour stuff, and it's come too late, I believe, for Roscommon County Hospital and the A&E department there. I think the thing that most people in County Roscommon, for instance, are saying is where has it all gone wrong? And you know, I think somebody famous once said, to solve the problems of the future, you have to look to the past. And in the past, back in the 60s and 70s and 80s, Minister, we had a matron running Roscommon County Hospital. And that's all people knew. There was one matron, the floors were scrubbed, the walls were scrubbed, there was no MRSA, there was no infections in the hospital, there was nurses and there was a consultant, and that's the way it was run. Today we have consultants, we have directors of nursing, we have assistant directors of nursing, we have clinical nurse managers 3, clinical nurse managers 2, night duty administrators, night superintendents, clinical directors, etc., etc. We have grade 8s. When back in the times I was referring to, we had 11 of them in the country. We have 717 of them in the country now. That's where it's all gone wrong. That's why we don't have an A&E service. The whole thing is not about patient care. It's about the fact that we have no money, and we have wasted money in the HSE. Since the HSE was established, we have wasted money, taxpayers' money, in the delivery of a second-rate hospital service and health service in general. With reference to Professor Crown's contribution, I totally agree with them. What we're doing now is stick and plaster stuff, band-aid stuff. But at this moment in time, Minister, I would accept a band-aid to fix the problems of Roscommon Hospital in the short term, so that in the long term we can actually deliver a service for the people in a rurally isolated area or part of the country that deserve it. With regard to the word reconfiguration that I've been listening to for the last 7 years from the HSE, nobody in the HSE over that period of time, Minister, has ever explained to the people of this country what it means. Nobody knows what it is. I have my own ideas as to what it might be, but nobody knows, and they're afraid. And all of a sudden, we're now hearing reconfiguration again, but unfortunately for the people of Roscommon, it's at a time that we're first telling you we're closing down your A&E department. We're about reconfiguration, and still nobody has explained what reconfiguration is. And I've always said, Minister, and I've said this directly to Professor Crown in the past, if he has a better vision for the delivery of accident and emergency in this country, let him put it in place first. Let him put in his advanced paramedics. And let's prove to the people of this country that as soon as they have their heart attack, as he's explaining, that there'll be somebody there on a motorbike or an ambulance to make sure that they survive it. Prove to them first that works, in tandem with the running of an A&E department. Then if that works, downgrade an A&E department. Don't take away the A&E department and then say we're going to put something else in place. Now, I attended a meeting last Friday week in Hawkins House, and I can guarantee you, Minister, nobody from HICWA, the Department of Health, had a plan for an advanced paramedic team at that time while they were talking about shutting down A&E in Roscommon. They had no plan. They will look at it. And this is the thing about it. And another thing that's being bandied around now by the Minister is mortality rates in Roscommon, that they're 5 times higher than they are in Galway. That might be the case, Minister, but I would genuinely believe that they're based on the fact that we're so far away from an A&E in Galway that can save somebody's lives, that they're dying on the way to Galway. That's the reality of it. It's not that they're dying in the hospitals. Everybody wants their hospital, their local hospital in particular. In my situation, they want their hospital up and running for the safety of themselves and their families. A question I have, Minister, in relation to HICWA. I know HICWA was set up by the last government via the HSE. Who directed HICWA, or was it themselves, to set the bar so high that hospitals like Roscommon can't survive? They can't deliver the service to deliver patient safety. Who set that bar so high? Was it set under the previous government? Or was it HICWA themselves that set it that high? Like, if we can't reach that bar, Minister, it's because of lack of funding and lack of resources in the health service. It's as simple as that. And back to my point again, I do not believe that this is about patient safety. This is all about money.
1 minute left, sir.
What I would suggest,
about
what I
sorry, I couldn't hear there. Sorry. You said it's not about patient safety.
It's not about patient safety. This is about money and about saving money, and it's saving money at the expense of the people of Roscommon in this case. Looking at today's paper, the Minister has put in an urgent care unit supposedly in Roscommon as a replacement for an A&E department. Now the IMNO are not cooperating with that. The ambulance service aren't cooperating with the Minister. And back to my point again, there's no advanced paramedics system in place. Can you enlighten us as to where we're going? Because I'm here batting for the people of Roscommon. I don't want to see patients and people dying on the roads to Galway, Minister. We have a serious situation, and I'll just refer to one thing that I said many, many times in the past. And that is that the geniuses that we had 50 years ago in this country that knew it all, like the HSE today, decided to take up the train tracks because they thought we'd never need them again. Now they realise they made a mistake. Are we going to realise the same thing again about the future delivery of health service in this country? Thank you, Minister.